Health officials in this province are also warning of a spike in influenza cases in younger people. The BC Centre for Disease Control is reporting higher cases among children, which it says has led to an increase in hospital emergency visits. Thankfully, no one has died so far. Dr. Tom McLaughlin is a pediatrician at BC Women's and Children's Hospital and joins us now. Doctor, thanks for being here. So the BCCDC numbers show an increase in visits to emergency wards. Is this unusual?
Yeah, so every year we see an expected increase in children who present for respiratory illness to our emergency department or need to be admitted to hospital. When I spoke to colleagues today about how this compares to previous years, we're seeing the expected increase here in Vancouver.
Okay. And when those cases come in, some of the concerns we've heard are, or when we ask, are these cases people who have been vaccinated with the flu or not? Can you break that down for us? How many people are showing up unvaccinated and vaccinated?
Yeah, I don't have a precise number for you, but what I can definitely say is that by being vaccinated, you are reducing your own and your children's risk of both serious disease and all disease. So it's one of the best things you could do to never have to be in the emergency department or not to be admitted to hospital.
Okay, but you have no sense of whether or not you're seeing perhaps a reluctance from people who are coming in to get the flu vaccine?
Yes, I do think that this year, like in the last few years, we are seeing an increase in people who are hesitant, who might have been exposed to misinformation about vaccines. We do see that this year. And what we can say in general is that when we look at every year, when we look at studies, the kids who are coming into hospital, there are more kids who are unvaccinated proportionally.
Now, the Ontario's Health Authority reported, as we said, 3 children have died due to flu-related complications. We don't know all the details of those cases, whether or not there were pre-existing conditions. What are some of those risk factors when it comes to when people get the flu, even if they don't have pre-existing conditions?
Yeah, and hearing that news, it's a tragedy, and
Indeed.
Every child who passes away from illness is something that we should take pause about. There are some children who are at higher risk. People who have had prematurity, who have complex health conditions, who have neurologic conditions, who have reduced immune systems, cardiac conditions. There's a long list of things, and those children rely on vaccines just like all of us, but also rely on all of us to help prevent spread to them who are at highest risk.
We have heard concerns that, and perhaps reports, that this year's vaccine may not be a perfect match to the dominant strain we're seeing.
That's correct.
What would you say to people who think, well, should I still get the vaccine that is being offered?
Yeah, yes, do still get it. It is true, the strains that are moving through the northern hemisphere are less well matched to the vaccine this year. We do see from the southern hemisphere that people who got the vaccine had a 50% reduction in need for hospitalization. That's a big reduction. So with this mismatch, it might be a lower number than that, but it's not going to be zero, and these things are still the best thing that you can do.
And normally a vaccine is not 100%. In terms of the flu vaccine isn't a 100% match. Is that correct? That's
correct. And the flu, every year, scientists around the world come together and try to predict what the most likely strains are. Flu is a very changeable virus. You hear about H3N2 and H1N1 and all these different strains, and there's even more details than that. We make our best guesses. And then even when those things are not perfectly matched, there's still immense value in the vaccines.
All right. Dr. Tom McLaughlin with BC Women's and Children's Hospital. We appreciate your time and your expertise. Thanks for joining us.
Thank you so much.